Hi everyone, my name is Randy Nguyen and today we will be talking about Altoprab or Lovastatin for generic. Here's the table of contents. Today we will first be talking about indication and dosing, second, dosing adjustments, third, mechanism of action, fourth, patient monitoring, and fifth, patient consultation. So first, indication and dosing. What is the drug? What strength is required? The first indication we will be talking about is the prevention of atherosclerotic cardiovascular disease. Altoprab or Lovastatin is indicated for patients 40 to 75-year-olds without diabetes and an LDL cholesterol of 70 to 189 milligrams per deciliter, and in patients with diabetes without additional ASCVD risk. It is also indicated in patients with LDL cholesterol of greater than or equal to 190 milligrams per deciliter and 20 to 75-year-olds as an alternative medication. It's also an alternative medication for secondary prevention in patients with established atherosclerotic cardiovascular disease. The second indication, also used as an alternative medication, is in heterozygous familial hyperlipidemia in patients unable to tolerate high-intensity statin. For all indications, either IR or in ER formulation, the dose is 40 to 80 milligrams daily. However, in the IR formulation, it is taken with an evening meal, and in the ER formulation, it is taken at bedtime. Now moving on to dosing adjustments. Are changes required in dose strength? For patients with renal impairment with a creatinine clearance of less than 30 milliliters per minute, it is advised to use Altoprab or Lovastatin with caution and carefully consider doses of greater than 20 milligrams a day. In hepatic impairment, it has not yet been studied and no dosage adjustment is provided in the manufacturer labeling. We will now be moving on to the mechanism of action. How does the medication work? Lovastatin is metabolized into its active form beta-hydroxy acid in the stomach and functions to competitively inhibit 3-hydroxy-3-methylglutaryl coenzyme A, or hmg-coa reductase. This enzyme is involved in the rate-limiting step of cholesterol synthesis. hmg-coa inhibitors also decrease level of high-sensitivity C-reactive protein, improve endothelial function, reduce inflammation at coronary plaque sites, inhibit platelet aggregation, and have anticoagulant effects. Also, a decrease in serum cholesterol will stimulate LDL receptor expression on hepatocytes, further increasing LDL catabolism. Moving on to patient monitoring. What should we observe for safety and efficacy? For patient monitoring, we are concerned with three things overall, being the lipid panel, hepatic transaminase levels or liver function tests, and the creatinine phosphokinase. For lipid panels, we want to monitor total cholesterol, HDL and LDL, and triglycerides. For hepatic transaminase levels, we want to monitor AST, ALT, ALP, and the total bilirubin. Lastly, patient consultation. What should practitioners discuss with the patient? The medication name is Lovastatin or Altoprab for brand name. It is used to lower bad cholesterol and raise good cholesterol, lower triglycerides, slow the progression of heart disease, and prevent heart attack and chest pain. Before starting this medication, the patient should consult the doctor if they have any allergies to this medication, liver disease, or increased liver enzymes, if they are pregnant or plan on being pregnant, and if they are breastfeeding. The patient should be consulted to check their blood sugar more closely if they have comorbid diabetes, take routine labs as indicated by the doctor, follow diet and workout plans, and avoid grapefruit juice or products as it may affect the medication and cause myalgias. Also, they should be consulted to notify the doctor if they are 65 or above or planning to become pregnant. What are some side effects that the patient should consult the doctor immediately? If they have any allergic reactions, inability to pass urine, muscle pain, tenderness, or weakness, and liver problems. On the other hand, some side effects that are to be expected are headache, back pain, and flu-like symptoms. Lovastatin is used differently depending on the formulation. If it is an immediate release formulation, it is used after an evening meal. However, in extended release, it is used at bedtime. If the dose is missed, take it as soon as possible, but if it is near the next dose, the patient should take it at the next scheduled dose and skip the missed dose. Lastly, here are my resources. Thank you all for your time.